Hello.
Hi there.
Welcome to From Skirts to Scrubs. I'm Alicia.
And I'm Charlotte.
And we are two medical students trying to figure out our place in medicine by looking to the past and to current events to better understand the impact they have on us as women in medicine and women in general.
Yeah, and you can find or follow us on social media. We have Instagram, Facebook, TikTok, which are all at From Skirts to Scrubs. We also have a Twitter, which is at FSTS_podcast. And we also have a YouTube channel now where we are posting this the literal recording that's going on right now in video content on YouTube. So go ahead and follow us, which is at From Skirts to Scrubs on YouTube as well. And then you can also check out our website where we have more information on our episodes, show notes, sources, and more, which is at FromSkirtsToScrubs.com.
Yes, and you can also subscribe to our podcast wherever you get your podcasts, including YouTube, as we mentioned, and leave a rating and review. Apple Podcasts is the best place to do that, but you can also leave us a rating on Spotify.
Yeah, all those are great things you can do. So welcome back to episode 56. And I just want to start this episode by saying that Alicia and I matched into residency.
Yay! We're gonna be doctors.
We're gonna be OBGYNs. I feel like for 4 years now we've been like, oh, we're medical students. Oh, we're potentially OBGYNs. But now, guys, we are officially OBGYNs. We're gonna be starting residency in July. It's gonna be a whole thing, once we start. But we're super excited, and look out, for our Instagram. You'll see like where we're going and how excited we are. And we're gonna be in the same city, so we're
so excited to be in
super happy.
city.
Not the same program, but same city, which is the best we could hope for, honestly. So
yeah,
just a super fun announcement from us. All right. So I'm really excited to get back into my first episode of season 5 and starting off with like a good old historical episode. So if you are a day one listener, then you know how much I love to talk about hysteria. It is like the topic where it's one of the things that made me interested in women's health and history in the first place. And I just think it's really important and super interesting, which is why we've talked about it a ton. We've talked about it in multiple episodes. We had a whole hysteria episode itself. We also talked about it in the Wandering Womb, in the Rescue, in the Asylums episode. Like it just like goes on and on, honestly.
How much we've mentioned coming up.
It's crazy. It's so important. That's why it's so interesting. So in this journey of continuing to dive into the many different ways that hysteria has shaped women's history, we're going to talk today about the history of the surgical procedure, the hysterectomy. So before we get into it, any thoughts, Alicia, before we enter, the whole story?
I love this topic, but I think it's so interesting because I don't know anything about the history of how we came to do the hysterectomy. I know what a hysterectomy is. I know the general steps of a hysterectomy. We did like a hysterectomy on a like person's donated pelvis a couple weeks ago.
Nice. I'm doing that next week.
It's good stuff, but I don't know anything about the history. And so I don't think I'll like dilly-dally. We should just get into it because
all right, let's jump into it then.
Talking about literally
the surgical procedure.
Yeah.
All right, let's do it then. Dance. Oh my god, now we can record our dancing in between everything.
I know.
Yay. Okay. All right, so in order to really understand and appreciate the history, first we got to talk about like what the heck even is a hysterectomy? Like I'm saying that because I know what it is, but that doesn't mean you know what it is. So a hysterectomy is a surgical procedure that removes the uterus from the body. And it can be done in a number of ways, which I will explain in a moment. And for a number of reasons. I was like, what am I saying? And so there's a bunch of different ways that you can remove the uterus from the body. And a lot of the ways that these surgeries are different are based on the anatomy and like how you're approaching the anatomy. Mm-hmm. So first we're going to do a mini pelvic anatomy review because I don't think we've talked about pelvic anatomy for a while. And not everyone obviously knows what the pelvic anatomy is in a woman or in someone with a uterus. So I want you to imagine a tiny little uterus in your mind. It can be like the cute little cartoon pink uterus, a smiley face on it if you really want. I don't really care what uterus looks like, but just imagine a uterus in your mind. Yes, oh my God, Alicia! That is perfect. If you are watching the video, this is perfect time. Alicia, continue to hold that up as I explain what a uterus looks like. So the people who are listening, you can't see Alicia holding up her cute little plush uterus, but a uterus kind of looks like a cone structure, where the like pointy part of the cone is pointing down. Yes. On either side of the top of the cone, there's a tube-like structure, which is called the fallopian tube. And those lead to the oval-shaped ovaries at the very end. Yeah. At the bottom of a cone, there's a squishy little donut structure, which is your cervix. And then this is not really an Alicia's plush toy, but on the other side of your cervix is your vaginal canal.
Oh, yeah.
All right. So now with that picture in mind of what your uterus looks like, we now have a uterus, tubes, ovaries, and all of that's connected to the vaginal canal via the cervix. But it's not just like hanging out in your pelvis with no help. There's things attached to it so that it's not floating around and wandering like a wandering womb. It's actually suspended in space by what you could imagine as like ropes, cables, things like that. These are the ligaments, arteries, veins, things that hold onto the anatomy and, supply it in different ways. And then over that entire structure, there's a large sheet draped over it. And this is the broad ligament, which is kind of like this big blanket giving all the structures I just mentioned a really big hug. And that is me trying to describe a female anatomy looks to you without actually showing you a picture.
That's pretty good.
Thank you. I think so. I think so too. All right. So now that we've had a little anatomy review, that'll help you think about the history a little bit more. But what do I mean by surgery that can remove the uterus? There's like a ton of different ways this can happen. And we're not going to get too into the nitty gritty details of surgery throughout this episode because honestly, I don't want to bore you because that can get a little boring if you're not a surgeon. So one way you can remove a uterus is a vaginal hysterectomy. It's a procedure done literally between the legs through the vaginal canal. It's most commonly done in low-risk patients, and the uterus is pulled out like literally through the vaginal canal. You don't touch the abdomen at all. You can also do an abdominal hysterectomy, usually meaning open abdominal. This is common for like a fibroid uterus or different cancer cases that might need to like dig around a little bit more in the abdomen. There's also the radical hysterectomy, which we'll talk about later. It's when you remove basically all the things I just mentioned to you in that anatomy review, as well as pelvic lymph nodes. And then there's also minimally invasive approaches, which are things that are like laparoscopic, which you might not know what that means, but it's kind of like a mini camera going through your belly button and two little sticks on either side. And you can do it with these sticks and a camera kind of to remove the uterus, and you don't have as many scars. And you can also do that robotically, which personally, a robotic hysterectomy is my favorite surgery ever. I think they're amazing. So those are different ways that you can do hysterectomies. And then there's a lot of different reasons that you might need a hysterectomy done as well. So there's a handful of ways to complete a hysterectomy, but it's important for me to mention, just for clarification, that a hysterectomy is just the removal of your uterus. If you're getting your tubes and your ovary removed, that is not called a hysterectomy. If you get all things mentioned removed, that's going to be a hysterectomy with a bilateral salpingo-oophorectomy. So it's just important to mention in case like you ever have these procedures done in the future and you're telling someone your medical history, if you say you have a hysterectomy, that doesn't mean your ovaries are gone. You have to have an oophorectomy on top of that. There's many layers.
That 5 times fast.
Oh my God.
Every bilateral salpingo-oophorectomy.
It's like robotic hysterectomy. Everyone just says like BSO, like RH or whatever at this point. But that's just important for like your own medical history. If you know someone who has a hysterectomy, like that doesn't mean they don't have ovaries, just points of clarification. Okay. And then to wrap up this little review section, there are various reasons you can get a hysterectomy, like tons. One can be cancer. So if you have uterine cancer, cervical cancer, ovarian cancer, any of these reproductive cancer, sometimes even rectal cancer, then you could get a hysterectomy. Fibroids sometimes leads to getting hysterectomies, endometriosis. There's a ton of reasons, honestly. And everything's like unique to you and your own history and your medical conditions. So just so you know. All right, moving into the history portion. All right, so there was one very well-known gynecological text from history. Alicia, if you remember what it is called that we always talk about.
Is it Is it the one by Galen?
No.
Is
But
it the Egyptian one?
it is the Egyptian one.
I forgot what it's
There is an
called, though.
Egyptian text. That's okay. There's an Egyptian text that we talk about, honestly, a lot because it's the first, like, physical evidence of gynecology in history, and that's called the Ebers Papyrus.
Yeah.
And I really want to go see it one day. I actually don't know what museum it's in, but I want to see it. Anyway, unfortunately, hysterectomies are actually not mentioned in this, which is surprising because, like, it's a huge gynecology text from ancient history.
Yeah.
So there was no hysterectomies being done when that was written, as we can tell, which is interesting because usually that's where we start our histories. The first hysterectomy that's mentioned is actually from Soranus of Ephesus, who we've mentioned in the past, who also did a lot of gynecology. And that was in the 1st century in Rome, where he writes of a patient who had a prolapsed uterus that was literally black.
Oh, no.
So, yes. So a couple things to digest here. One, what the heck is a prolapsed uterus? That is a uterus that is protruding out of your vaginal canal. And it's very common in women who have had many vaginal deliveries and older women, things like that. Things get a little loose and it can get a little like slacky and it like goes out through the vagina. So that is what this woman had. And then if you don't know, if something on your body is not already black, then it should not turn black. Like that's meaning that something is dying, you know?
Yeah.
So if a uterus is poking out, it definitely should not be dead or the color black. So this woman basically had a necrosed, which is what dead is. Yes, a necrosed prolapse uterus. And in the story, they actually cut it off. So they said, oh, that uterus does not look healthy. We're just going to chop it off. So that technically was the first hysterectomy. It was basically a vaginal hysterectomy. Yeah. And then around the same time, a physician named Themison of Laodicea from Athens is mentioned in a story of someone talking about a hysterectomy where they said, now one must not suppose the uterus to be essential for life. Not only does it prolapse, but in some cases, as Themison has related, it has even been cut away without bringing death. So they're like, okay, you can cut out a uterus, especially if it's falling out of the body. The patient will not die, which makes me think that hopefully some of the patients they were doing this hysterectomies on were alive. Because you'll see later that, you know, not all of them turned out so well. So I'm glad some women survived in the early 1st century. So at its core, like these procedures are vaginal hysterectomies. Literally today, you're not going to be like, oh, wow, uterus is falling out through the vagina. Just chop it off. It's not that easy.
Get some scissors.
But, yeah. But it's essentially what the procedure is.
Yeah.
All right. Then there's a lapse in time. Like that was the 1st century. Now we're jumping ahead to the 16th and 17th century. Between them, there's not much mention of hysterectomies. And at this point, there's much more going on with the procedure. And Alicia, what do you think like might have caused hysterectomies to become more common at this time? Like 16th, 17th century, some type of condition that people were like, we need to cut out the uterus.
Maybe like antibiotics?
No, it's the 16th and 17th century.
Okay,
sorry. One was not made.
Okay. Right,
like,
you're
think
right.
like medieval Renaissance. That's the age, but I don't know if that helps. Why would you cut off a uterus? Especially if you can't like do x-rays and see stuff that's going on inside the body. Then you're seeing something happen outside the body where you're like, we should cut this off.
Is it like more people were having a lot more babies, so a lot more prolapse was happening? Like, I don't know. This is a leading question. This is a leading question, and I don't know the answer.
That's okay. It's okay. It was cervical cancer. There was a lot of cervical cancer.
How on earth was I going to know that? Literally, how was I going to know that?
Because you can see it from outside the body. You don't need anything to like see inside the body, see cervical cancer.
Who was looking in the vagina? Who?
The gynecologist.
The speculum wasn't invented until ages later.
That is what supposed to know that. I don't know. But we do talk more about cervical cancer in episode 52, where we like go through the whole history of cervical cancer, HPV, the pap smear, all that stuff. But without treatment, cervical cancer is like pretty nasty. It's bad. It can grow a lot and become this like cauliflower-like lesion in the vagina. It can eat into the uterus and the vaginal canal. It's really nasty cancer. And so hence the need for surgery can be quite high because you need to get that out of there. And with cervical cancer, a physician can like see the cancer through the vaginal canal. I don't know what they were using to do it because, like Alicia said, no speculums at the time, but they could see the cancer like protruding from women. So they knew they needed to cut it off. So therefore, starting in the Renaissance in the 1500s and moving into the 1800s, we were seeing a lot more surgeries specifically done for cervical cancer. And then, of course, like the prolapsed uterus. So so uterine prolapse and cervical cancer really led to like a rise in hysterectomies being done.
Okay.
And some of this history, yes, now that makes more sense, right? But some of this history can get a little nitpicky at this point. Like, oh, this surgical technique happened here, and then this man did this thing, and this man used this one small little technique. And I'm really not going to bore you guys with any of that. Like, I'm personally interested in minimally invasive gynecology, but I don't think you all are, and you don't want to know the details. But I do like, we're still doing the episode for the reason that it's interesting. So I'm just going to generally talk about how hysterectomies developed in the 1800s as it like really became to be a major procedure. So as vaginal hysterectomies started to come about in history, people, had been performing them for a while, but so many women were dying. And they'd be like, oh, the uterus was removed so successfully, but the patient died 3 days later. And that was happening all the time. Like there were tons of uteruses being removed and then women dying right after. And if you had to guess, what was causing these women to die, Alicia, based on your surgical knowledge of why hysterectomies can get really messy sometimes?
Was it bleeding?
If you really mess it up.
Oh.
Yeah. So these women were hemorrhaging like crazy, which means you were really bleeding out. Because a big part of the anatomy of the uterus is that there's a ton of arteries, for one, going to the reproductive anatomy, to the ovaries, to the uterus, everywhere. But the big boy, the big kahuna, is the uterine artery.
The uterine artery.
Yeah. Like this is a real sucker. When you cut it, it bleeds so much. So much. Like personally, oh my God, personal story of this. I was in a surgery with a general surgeon who was removing rectal cancer, and he was like, oh, I can do a hysterectomy. I'm going to perform a hysterectomy myself without gyn-onc here. So he starts doing the hysterectomy, cuts the uterine artery, and there's blood everywhere.
Oh, no.
And gynecologists and OBs are so used to blood. Not all surgeons are used to their field being super bloody. He was like, oh my God, we had to call in gyn-onc, and the gyn-onc was like, what have you done? Like,
oh, no.
This shouldn't have bled so much if you knew where the uterine artery was and how to cut it correctly. So,
did he cut the
uterus? Yeah, that was
though?
bad. And I was like,
Did the ureters get chopped?
No,
that's good.
No, I don't think so, but it was really complicated because of the cancer. So we also had to call urology in to make sure that the ureter was fine because the cancer had like eaten into the uterus, into the rectum, like everywhere kind of thing.
Yikes.
It was a whole mess. The uterine artery can be really bad if you don't do the surgery correctly around it. So because of that, when this surgery was in its like rudimentary phases, a lot of women were dying because they were bleeding out and the surgeons like didn't really know what was going on or like how to fix this, or they just didn't have that surgical technique yet. So they were doing their best to try and fix it. One man by the name of Jacopo Bernardo da Carpi of the 16th century was Italian. The first that's been recorded to try and use, yes, it's very Italian. He was the first to try and use something to ligature the artery. So he used literal twine. Yeah. To ligature the artery. And then he was the first to try. And then one specific surgery that was done in the 1800s was actually done by this man named Conrad Lagenbeck. And he was the first person to successfully do a hysterectomy, meaning the uterus was removed and the patient didn't die. And this was for a cervical cancer patient. But this is actually kind of funny story. So just mentally prepare yourself. All right.
Okay.
I'm going to take a deep breath this one. Okay. So this man, Dr. Lagenbeck, was like, all right, time to perform the cervical cancer surgery. He had an assistant, but his assistant showed up to the surgery and he had a gout flare at the time. So
Okay.
this is important because the surgeon, tried to do the cervical cancer procedure as a vaginal hysterectomy because that's what they knew at the time. And he had to do it alone because his assistant's toe hurt too much from his gout flare to help. So it got to the point where the surgeon is doing a surgery alone, which I can't even imagine doing a surgery without an assistant. And he was holding the ligaments of the uterus together with his teeth at one point in the surgery.
Oh my God. No.
Imagine putting your mouth
Ew, ew,
in the surgical
ew,
field.
ew, ew, ew.
Isn't that so bad?
That's disgusting.
I can't imagine. I literally can't imagine. And he's
No.
like, dude, can you help me, please? And the assistant's like, sorry, man, my toe hurts too much. Like, I can't.
Oh my God.
help.
One of my friends, this is funny. It's like, it reminds me of this. It's like when you're like, so when you're in the OR and you're the medical student, you're like, he was on like an oncology rotation. So those involve like removing cancers. And then like you take like the sample and you usually send it to pathology and they can like, those are the doctors who look at the cells and like know what kind of cells they are, if they're cancerous, blah, blah, blah. It helps with staging. And he had the like intrusive thought of what if they like they will hand you the specimen. So they'll like give you the sample of tissue.
Yeah.
And he was like, I just had this like intrusive thought. What if I just went, oh, and put it in my mouth and ate it?
That is an insane intrusive thought. I have never had an intrusive thought like that.
I was like, oh my God. And then it's like, oh my God, the med student ate the tumor.
Oh, because sometimes like when I was on Gynonc, they like hand me a specimen and be like, tag it for pathology. And like I'd have to like tie it twice here and once here or whatever. But never was I like, I should eat the specimen. I feel like my intrusive thoughts during surgery is like, touch this, touch my face, touch anything. Like you like are so uncomfortable in surgery when you're not used to it because you like can't touch anything. I don't think people understand that you literally, if you're scrubbed in, can't touch anything. And it's so infuriating. My intrusive thoughts are like, just put your hands down. And I'm like, I can't do it. That's hilarious, though.
Isn't that so
That's kind of what this doctor was doing. He like
was
that's
so gross though, because he really did it. Like this is just an intrusive thought. This man was literally holding stuff in his teeth. Ew.
Yeah. And then at one point he lost the uterus. Don't know what that means. Don't know if it was lost in the abdomen. He had to like go in and find it, or if it was on the floor or what. But the uterus was successfully removed and then lost. So he had no proof of this uterus. Ridiculous. This whole thing was so ridiculous that a lot of people in the medical community was like, no, this is not a successful hysterectomy. Like, yes, your patient lived for 20 more years, but like this was not a success. Which is hilarious and wild story. I'm gonna think about that when I do hysterectomies now. So anyway, that's the funny part, but it's also super important to note that like this whole procedure, this whole ridiculousness was done with the patient not under anesthesia, because this was done in the early 1800s and anesthesia was not used for the first time until the mid 1800s. So all of the history we've talked about thus far practically was not under anesthesia because
that's
it wasn't
crazy.
What
were they doing?
And that's not to say
nothing?
Right? I don't know. It didn't say, but like I can't imagine there was nothing, because they still had opium, they still had alcohol, like they had ways, to like dull the senses, and obviously people knew like that these things are going to hurt and they probably gave them pain medication, but like that's different than anesthesia. Like anesthesia is not just managing your pain. There's a lot of different levels to what anesthesia is and how it puts you to sleep per se for surgery, and it's not just pain management. So they might have had pain management, but not not to the extreme they should. So something interesting to think about at this point, I think, is like, how does it feel, Alicia, to know that the beginnings of a surgery that is like very integral to our future profession that we're joining now, beneficial to so many women in society, was literally pioneered in like such a painful way? And we'll talk a little bit more later about some other questionable things about this history, but I think the lack of anesthesia, knowing how much like patients were dying to begin with in this story, is interesting to like think about.
Yeah, it reminds me a lot of like our very early episode and just like the general history of like the speculum and early OB-GYN and J. Marion Sims and Anarcha Betsy and Lucy and the other enslaved Black women that were experimented on without
Mhm.
anesthesia, without pain medication. And that's how we came across and came to learn about so many of these beneficial techniques that we use now. And I think that's one of the really dark sides of medicine. And that did not sound profound as I said it out loud, but I'm just like, I really do think that
Yeah.
it's one of those like people see it as ends justifying the means. And that's not really true. I don't think like you can't just justify these horrible things that happened. Um, and there's like room for reparations now, and there's like room to think about how we can minimize harm and minimize pain in our patients now. But yeah, looking back and knowing that that's the
Mhm.
history is really terrible. And I think something we have to remind ourselves is, we have to think about history in the context of the time. And there wasn't
Yeah,
any
for sure.
anesthesia available at that time. And so it is unsurprising that they couldn't use any, but also they were
Mhm.
curing these women of cervical cancer. And so I guess it's like a risk benefit analysis there
Yeah,
too.
I agree, and I think something that differentiates this story from Anarcha Betsy and Lucy in Dr. Sims is that that was done without consent. Like those were
Yeah.
enslaved women who were put through these procedures so many times, so awful, so terrible. I really recommend everyone listen to the episode. It's like our third or fourth episode. But I have to believe, and I hope to believe, that a lot of these women who are getting these surgeries done for prolapsed uterus, for cervical cancer, these are conditions that drastically alter your quality of life as a woman. I'd hope that these procedures are done under consent. So it's kind of interesting that like these women would consent to having a procedure done without like a fully fledged anesthesia occurring. And it kind of makes me think of not the same, but similar to even like any clinical trial you join. Like a lot of
Oh, yeah.
patients will consent to be being a part of a clinical trial, especially if they have like a terminal illness, because they're like, if this trial can make me feel better, I will do it and I will suffer like the potential consequences so that, I can like get better. And also, like, the general community of people with this condition can also benefit from me being in this. And I wonder if like there's no way for me to like actually speculate and be like, yeah, that's what these women were like in the 1800s. But maybe they were like, I need this freaking prolapsed uterus out of my body. I
Yeah.
don't care how much pain it is. It is
Hmm.
getting in my way. I need it out. And they're like, I will do it anyway. Or like, the cervical cancer is eating away at me. It's super uncomfortable. I can't have a sexual life, anything like that. They're like, I'm going to do this procedure despite anesthesia. It's just something interesting because I feel like they would have consented. I don't know though. I can't 100% say, but it's definitely very different than the previous situation we've talked about a lot with Anarcha Betsy and Lucy, in that they didn't have consent at all, which really changes the whole story, I think, in my opinion.
Yeah, I
Um,
agree. And I think too that their story there was the existence of anesthesia, but anesthesia
mhm.
was chosen to not be given. I think that's like a big difference too.
That's true. Yeah, exactly. And this is like, there wasn't as much
There
anesthesia,
wasn't an
especially when we
option.
talk about procedures happening in ancient times. Like, there was no anesthesia then. Like, there was
Mm-mm.
no medicine then. They, gave them opium and was like, we hope you don't feel this. Let's go. So just something to consider. And at this point, I want to read a quote from the London Medico Review from 1825. And it says, a more cruel, bloody, and ill-judged operation is not, we think, recorded in the annals? Annuals? How do
Annals?
I say it? The annals? Recorded in the annals of surgery. We consider the removal of uterus not previously protruded or inverted one of the most cruel and unfeasible operations that was ever
Mm,
projected or executed by the head or hand of man. So, kind of interesting. They were like, removing a uterus kind of messed up, is what they were saying about hysterectomies at the time. They do say,
interesting.
if it's protruded, then we should definitely remove it. But they're like, if it's not, then why? So
Yeah.
that's something interesting to consider. All right, moving forward, we're still in the 1800s, but now a surgery that has become very popular and successful, it's not a hysterectomy, is the ovarectomy. So they're removing ovaries, becoming super common in the 1800s. And mostly it's because physicians were able to palpate like enlarged ovaries and cystic ovaries. And they were like, all right, we can get in there, remove them. There's other abdominal surgeries being done. A lot of times they were being done by general surgeons who were already doing abdominal surgeries. And they saw the ovaries are all messed up and they were like, let's get those boys out.
Right.
If you ever look at an abdomen, I don't know why anyone would, but if you ever look at an abdomen where there's a really enlarged ovary, like that boy is looking right at you. So people are like, let's get that out. So they were like, let's do that. And while that's really interesting, we could dive into like a whole history of ovaries being removed probably. Let's focus on hysterectomy. So why I bring this up is important for our next story of a surgeon named Charles Clay. And Clay was practicing medicine in Manchester, England. He was performing an ovarectomy when a patient coughed, probably because there wasn't as good of anesthesia at the time. So she coughed during surgery. And while the abdomen was opened up, the uterus popped out. It was like,
oh my God.
boop. And she actually had a fibroid uterus. So like a regular uterus should only be like the size of your fist. And a fibroid uterus can be ginormous. Like I've seen fibroid uteruses that are as big as a basketball sometimes. Like they can be huge. So I don't know how big this woman's was, but she coughed during surgery and the fibroid uterus went boop. And the surgeon, Dr. Clay, was like, maybe I should take this out too. This looks bad. And it pops out and it popped out. Like, I don't know where to put it now. And so abdominal hysterectomies were born. Unfortunately, this patient also died from bleeding to death after the hysterectomy that was performed.
Dang.
Yep. And for some time, this continued to occur. Patients would go into surgery because doctors thought they had enlarged ovaries, and then they would get into the surgery and it'd actually be a giant uterus or fibroid uterus or a cancerous uterus. And for whatever reason, they'd be like, let's get this out of here. They'd cut the uterus out. They'd cut the uterine artery and the patient would bleed to death. And that just kept happening over and over again to the point that the mortality, to the point that the mortality rate of hysterectomies in the 1800s was 70%.
Bro, when did they figure it out then? Like, when did they finally get it together?
Yeah, so the actual first successful hysterectomy, not the one where the dude kept his teeth on the ligaments, like the actual first successful hysterectomy was in 1853, which is not that long after anesthesia started being used. And this patient was under anesthesia and they used much better surgical precautions because surgery was like finally starting to be like, maybe we should use instruments instead of our hands and like things like that. So surgery was advancing in general, anesthesia had advanced, and therefore we finally had a successful hysterectomy where the patient survived and did not bleed to death and kind of led on to more successful ones in the future. And the patient, after the surgery, which I thought was funny, had a cocktail of brandy and opium to help with her pain. So
okay. Yeah, that'll do it.
To have done well. Yeah.
Good for her.
I know. Also around this time, the first C-hyst happened, which is basically when you're in a C-section and you're trying to close up the uterus, which no matter how clean your C-section is, your uterus is going to bleed. And if it can't stop bleeding, they've done everything that you can possibly do, you have to remove the uterus. And it's like the last stop thing you do, but it happens. And it's called a C-hyst or like a cesarean hysterectomy. But that also happened for the first time in like the 1850s.
Dang.
Yeah, I know. And C-hysts are crazy. I've personally never seen one, but they're bad. You don't want one. You don't want to go into a C-section and come out with no uterus. Yeah. That'll only happen if you are like, they're like saving your life by doing that. Anyway, the last type of hysterectomy that we will cover today is the radical hysterectomy. So I briefly mentioned at the beginning, this procedure was developed in 1898 because surgeons noticed that they were removing the uterus and the ovaries and all this stuff to cure or attempt to cure cancer, but the patients were still having cancer and that the cancer was coming back in places outside of where it originally was and outside of these like margins or surgical margins or what they're called. So they thought, all right, well, if the cancer is coming back, let's remove more. So they started removing basically everything like by the uterus. So they removed the whole uterus, all the ovaries, the tubes, the broad ligament, the cervix, the entire vaginal canal, all the pelvic lymph nodes, which are
Oh
the
my
things that
God.
cancer travels through, removing like the peritoneum, like removing like as much as possible, basically, to make sure the cancer doesn't spread. And this surgery is super extreme. It does
Yeah.
not happen today. There's a ton of complications to this, a lot of anogenital complications, fistulas that were formed, impairments to patients' sex life in the post-recovery period. Like, it's not great. And so it didn't last very long. Once radiation therapy was developed, radical hysterectomies became a lot less popular because now you can do a more conservative total hysterectomy where you still remove most of the things I mentioned, not the vaginal canal, but like the cervix up, and you remove like usually 1 or 2 pelvic lymph nodes just for staging, which is a lot more detailed process we won't get into today. But you can remove stuff and then do radiation on top to really make sure you get all the baby cancer cells that you can't even see.
Dang.
So we don't do radical hysterectomies anymore, but that was a crazy procedure that had a ton of complications. Like, people had a lot of lymph node issues, just so many issues, and it was not great. But they were on the right track of thinking, but they were like, this surgery actually sucks. We're not going to do this anymore.
Yeah, close, but no
yeah.
dice.
Yeah, exactly. You were right on the point, but not exactly.
Yeah.
And then just a few wrap-up notes about the history of hysterectomies is that laparoscopic hysterectomies, which is the one with the camera through the belly button, that was developed in the 1980s. And now there's even robotic hysterectomies, which has a couple more cameras, and the doctor sits in the corner of the room kind of playing a video game while the robot does it. And it's amazing. It's my favorite. And then another thing is that in the early 1900s, most hysterectomies were actually done by general surgeons because at that point, the field of gynecology wasn't like a separate surgical field than general surgery. And so a lot of general surgeons were doing these hysterectomies, and they were already used to abdominal surgery. They didn't want to be like near the vagina. So they were doing abdominal hysterectomies. But today, if you're getting a hysterectomy and you're not a cancer patient, you will most likely either get a vaginal hysterectomy or a minimally invasive one, which is like laparoscopic or robotic, because they're a lot safer, they're a lot less scars, lower complication rates, etc. All right.
Dang.
And so, yeah. So before we end this episode, I just want to talk about the misuse of the hysterectomy, because it's an amazing, beautiful surgery. It has a future OBGYN. Like, it's so cool, but it has really been misused and has been used to mistreat women in the last like century, since it has become a successful surgery that they can do without women dying. It's been used incorrectly on a lot of women. And there's like 2 instances I really want to talk about right now. And like both of them are kind of things we've talked about before, but I just want to frame them specifically in the hysterectomy in this moment. All right, so the first one is forced sterilization, which is something we've talked about in episode 29 that Alicia talked about in great depth, and everyone should for sure listen to. And it goes, into a lot more history, but just to kind of like recap that here a little bit and talk about the hysterectomy. So there was the eugenics campaign of the 20th century. During this time period, there was a major push for states throughout the United States to sterilize women. So women who were deemed unfit to have children, or women that the government just simply didn't want to procreate, which included women with mental illnesses, incarcerated women, women with disabilities, women with high sexual activity, and most commonly women of color. Like I said, we talk about this so much more in Alicia's episode, but I just want to mention it here because specifically because the generation of women that were abused by these forced sterilization laws and procedures are the mothers and grandmothers of many women who need hysterectomies today.
Yeah.
And this is important because whether you're someone who's been personally affected within your own family history by this, or you're a future medical provider, or if you have friends who are affected, like whatever reason, it's important to note because women who need hysterectomies today might feel really uncomfortable with the procedure, might feel really uncomfortable talking about it, just knowing like how it was traumatic to their own family or to your patients that you're working with. And specifically, this is a big topic, especially for women of color and patients of color. And I bring this up because a 2009 study found that Black women are actually 4 times more likely to receive a hysterectomy than white women. And there can be many factors to this, but one really important thing to think about is fibroids, because fibroids is a huge reason people might get a hysterectomy. You can get what's called a myomectomy, which is where you remove the fibroids from the uterus, another one of my favorite surgeries. But sometimes it's not always an option, or women don't want that and they want a hysterectomy. So fibroids can be a huge reason you get a hyst. And according to a 2020 article from the University of Michigan, 25% of reproductive age Black women have fibroids, which compared to white women is only 6% of white women have fibroids. So
Dang.
a lot of Black women have fibroids, which could lead them to having more hysterectomies. And then by the time Black women reach the age of 35, the percent of people who have fibroids can get up to 60%, which is a ton of people. And while fibroids don't always warrant a hysterectomy, and there needs to be more research on understanding why Black women have such higher hysterectomy rates than white women in today's society, despite the fact of like the fibroid issue, because there's definitely like more confounding things in that equation of counseling. It's just important to consider because it's important to consider because while the procedure should not be being done, and I hope to God not being done for eugenics today, the history is still very strongly tied to women of color who still have very high hysterectomy rates. And so it's just an important conversation, important things to talk about and think about if you're someone, in that space. And it needs to be something that's looked into more of why Black women have more hysterectomies, especially with the negative history around that.
Absolutely.
Any thoughts,
And
Alicia, on that?
to add to that, and just like generally, a website actually that I only recently learned about, but that I think is an interesting, helpful resource for people who are thinking about hysterectomy or trying to find their options or just want to have like an online forum. There's a website called Hyster that's
I'm gonna look
essentially
it up
like,
right now.
it's literally like a patient forum. It's like a open forum, and they have a bajillion articles. And I can't necessarily speak to supporting or saying like, oh, I support all of these articles and everything that they post. But I think as long as you understand that going to that website is not getting medical advice, but just to hear about people's experiences and what things have worked and
be
not
part of a
worked for
community.
them, going into or deciding to do surgery, I think it's like a really helpful resource. And like I do know people have used that, or I've just heard of that website. And so I wanted to throw that out there because I think,
Cool.
when you get a surgery, often you'll like try to find other people who've gotten that surgery. How was their recovery?
Yeah.
What was that like for them? And that makes
For
the
sure.
idea of getting surgery a lot less scary. And so I do think there's like a lot of benefit to having community and a forum of places for you to go and get this information or have your questions answered that's not just from a medical professional. And this could be a good place. But it is important to listen to your doctor and to heed their advice when it comes to your specific case and your specific medical needs. Sister.
For sure. Having sister. I mean, making a decision as big as a surgery, as big as a hysterectomy, especially if you are a reproductive aged woman, that's going to like end your chances of birthing your own child if you get a hysterectomy in your reproductive age. It's important to make your own medical decisions. Like medical decisions is a shared process. The doctor should not be telling you what to do, and they should be advising you on the options and recommending options to you and having a fully fledged, well-informed conversation with you about what you should do next. And then if you feel warranted that you need a second opinion for whatever reason, then that is totally up to you to do. And also, rely on other people to hear theirs with in mind, of course, what the doctor advised to you. But no one should be telling you what to do. It's more, this is my professional advice and I'm here to support you. And, let's talk about it. And so something to consider. And hysterectomy is it's a major surgery. And so something, I love that. Sister. I'm going to write that down and recommend that to patients to check out then.
Sister.
All right. And then the second big sister. It's like herstory, or, you hear that a lot with, especially because Women's History Month. Anyway, the second thing and the last thing we'll talk about is the use of hysterectomies in asylums. And we talked about asylums. I feel like I mentioned so many other episodes in this episode, but it's just because this applies to so many things we already talked about. We talked about asylums. It was the last episode of the last season, and it was a huge thing to do to women. Unfortunately, in the 1800s, in asylums. And specifically, I want to talk about one physician from the London asylum, Dr. Maurice Buck. And this doctor, who worked in London, believed the common belief at the time that if you treat the body, then you treat the mind. So if you have something going on with your mind, then you need to treat your physical body, which is slightly true today as well, of course. But he really took it to an extreme, to the belief that the idea of hysteria, where a uterus is causing a woman's illness, and that was the belief of hysteria. It is not correct. He thought, well, okay, if the uterus is causing issues, then we should just get rid of it. Like, why are we keeping this uterus around if it's causing this mental illness? And so he used hysterectomies as a form of medical of treatment for mental illnesses. And let's also consider this is being done on women in asylums who we know from the asylum episode most likely did not have consent in this process, had things done to them that they, did not consent to or did not want. And a lot of women were put in asylums who did not have mental illnesses either, and were just put there as a way to constrain them and to have social pressures on women and have the scare of being sent to asylums because they're not conforming to society. So a lot of women, it's not correct to do a hysterectomy unconsented on anyone, mental illness or not, but there was a whole wide range of women this was happening to in asylums. Kind of crazy. And I actually read an entire speech this man gave. It was 11 pages long. He gave to a gynecology medical society in London in the 1800s.
Okay.
And
TLDR.
He basically it was a lot. He basically went into numerous stories of female patients from these asylums where he removed their uteruses, and then he was like, oh, they were cured. They were insane. And then I did hysterectomy, and then they were cured, which there was I truly doubt that is what happened. But he claims he did this to over 100 women. He did this until 1902, actually. Too recent for comfort, in my opinion. And he did this to a ton of women. And this is only one asylum in London. This is not talking about other asylums throughout Europe, in the United States. Doctors talk. If this man was giving an entire speech to a medical society recounting how this surgery supposedly was curing women in his asylum he worked in, who knows what was done in other asylums as well. So something really crazy to think about. And he stated in this address that many women are needlessly and improperly confined in asylums suffering from reflux cerebro nervous disturbance, which is basically them saying that they were insane.
Okay.
Because of periuterine irritation or disease, which might be cured by operative or local treatment. So this man was the king of false news. And so that was not great.
No.
Bad.
He watched so our politicians could run.
Literally, he did. He lied. He was like, these women were cured once we were with their uteruses. In reality, they probably were terrified because their uteruses were removed, and they were like, I'm just going to act like I'm cured and they'll get me out of this crazy asylum. Wild. So hysterectomies were basically built on the backs of countless women who have died, women who are mistreated, to create this extremely beneficial surgery to women today. And it is used for so many conditions and is so important to especially gynecology and oncology, where, removing a uterus and other structures can literally save a patient's life with the treatments we have today. And as I mentioned many times, robotic hysterectomy is my favorite surgery ever. It's so clean and beautiful. So it's a very fun history for me to cover, and I hope you all enjoyed it too. And with that, Alicia, unless you have any other thoughts, we'll see you guys next week or next time.
We'll see you next time. Hysterectomy.
Yeah.
Good stuff.
Yeah, hysterectomy.
I'm just happy I got to use my plush uterus in this episode.
That was so unexpected and exciting. I didn't even tell you we were doing anatomy review.
No, I had no idea. It just sits on my desk.
Oh my God, I love it. I need one. That's adorable. So anyway, you guys should subscribe to the podcast. We have so many episodes that come out every other Tuesday. You can subscribe on your favorite podcasting app. We don't care which app it is, but also try and leave us a rating and review. And Apple Podcasts and Spotify are great places for you to do that.
Yes, and you can follow us on social media, on our YouTube channel, as well as check out our website, which is from scrubs.com. That'll get you all of our show notes, our sources, merch, and more. And lastly, here's to the women who have fought for us to be where we are today, and may we do the same for those who come after us.
Yeah.
We'll see you next time.
See everyone next time. Bye.
Bye.
And stop.